This morning, our Facing Fertility series explores an often forgotten part of the fertility journey, the end of it. Perimenopause, the transitional period before menopause, typically begins in a woman's 40s and can last until her late 50s. A new study from the Mayo Clinic found 3 out of 4 women they surveyed experienced menopause symptoms, yet more than 80% did not seek medical care. Nikki Battiste looks at a treatment option that historically has been misunderstood, but is helping many women.
It's remarkable what women go through and how much suffering silently there can be.
Unnecessary at that.
Dejanira Abreu was 45 years old when she first started noticing changes with her body.
But I was getting hot flashes, a little sweat at night.
What did you think was going on?
I just thought I was getting older, and this is what happens. It's the end for me.
She didn't know it then, but Abreu was going through perimenopause, the time before menopause, often marked by symptoms like sleep problems, depression, low libido, urinary frequency, and hot flashes. The average age it begins is 47. A mom and wife, Abreu says her symptoms included low mood, and it was impacting her marriage.
What made you seek out Dr. Dunham?
The sweat became worse. Like, I was changing my shirts 2 and 3 times a night. So she said, "You want to try it?"
So this is an example of a transdermal or skin-based therapy.
Abreu's doctor, OB/GYN Samantha Dunham with NYU Langone Health, suggested she try menopause hormone therapy.
What is menopause hormone therapy?
Hormone therapy consists of an estrogen, which really takes care of the symptoms. And then if somebody has a uterus, they need to take some kind of progesterone.
The medication is often delivered in a patch. It can also come in the form of a pill, gel, cream, or suppository.
The very first time Dr. Dunham mentioned menopause replacement therapy, you were reluctant?
I was. People in general just say all kinds of different things, and they say, "Oh no, you get breast cancer and this and clots."
Dr. Dunham says flawed research from more than 20 years ago overstated the risks of breast cancer because it focused on older women. A recent study found timing matters. The ideal age most women should take hormone therapy in order to mitigate risks is between 50 to 59.
Do you feel like in your time specializing in menopause, you've seen less reluctance to try hormone therapy among your patients?
Oh yeah, people come in worried that they're gonna miss the boat, and they should feel confident that they're not missing the boat because they have the option to start menopause hormone therapy for even up to 10 years after their last period.
Abreu was feeling depressed and gaining weight, but it was after she suffered from a fracture attributed to a loss of bone density that all the symptoms were becoming unbearable.
So this is your patch.
This is my patch.
She finally decided to give hormone therapy a try.
How do you feel different that you've been on the patch?
I feel alive, and I feel like I can just do life, whatever comes your way.
Are the hot flashes gone?
Yes.
I feel like there's a stigma around menopause. None of us want to go through it.
Our society isn't so welcoming of aging. It's a natural process, so I think it's important to talk about it so it doesn't feel as isolating as it could.
I'm going to put it on the left-hand side now.
Now Abreu is making it her mission to share her experience with other women.
Please talk to your doctor, and it's really life-changing. I wish I didn't suffer those couple of years.
The FDA has long mandated so-called black box labels on menopause hormone therapy, warnings about stroke, blood clots, dementia, and breast cancer. But now there are signals it may remove some of those warnings on some treatments. And more good news, earlier this week, the FDA approved a new non-hormonal drug to treat hot flashes and night sweats for women in menopause. So, Nikki, are there women who still shouldn't take hormone therapy? It's a great question. I talked to one doctor who said that some women who have certain breast or endometrial cancers would not qualify for systemic hormone therapy, but new research indicates that some forms of local hormone therapy, like a vaginal gel, might be safe for them. But anyone considering hormone therapy should, of course, talk to their own doctor.
I mean, it really is something that my friends talk about because it's like, is it perimenopause? Is it not? You kind of get really suspicious about everything. Can this be diagnosed easily by a doctor?
The doctors say it's tricky to diagnose because you have brain fog and you think, am I losing my memory or is this perimenopause? So you really just have to find a doctor who knows menopause, tell them your symptoms, and just keep asking for help.
This is great for men of a certain age that are with women of a certain
Exactly.
age. So the learning that we are doing, it helps. So thank you.
All right, Nikki, thank you so much. Tomorrow, our Facing Fertility series looks at an often taboo part of the conversation, male infertility.